Welcome students to the topic adrenergic receptors. So myself Dr. Divya Bhargavan will take you through the adrenergic receptors. So when the sympathetic system is stimulated or activated in a state of fear, fight or flight. So you have the neurotransmitters which are released, especially noradrenaline. You also have adrenaline. So neurotransmitter noradrenaline, or it is also called as norepinephrine. Adrenaline also called as epinephrine, or it could be any of the adrenergic agonist. Now how do they produce a effect, a response? So once it is released from the nerve terminal, uh, neurotransmitter, it will go and bind to the receptors. That is how they produce an action, through the receptors. So adrenergic receptors are membrane bound G protein coupled receptors. So adrenergic receptors are of two types. We have alpha receptors and beta receptors. Alpha receptors, we have two subtypes, alpha 1 and alpha 2, whereas beta receptors, you have three subtypes, beta 1, beta 2 and beta 3. So adrenergic receptors are present postsynaptic. So this is a adrenergic nerve terminal. This is the adrenergic nerve terminal, and you have the neurotransmitter which is released, that is norepinephrine. So this is a synapse. So on the postsynaptically on the organs effectors, we have the receptors. Okay, so these drugs bind to the receptors and produce the action. So you have alpha receptor and beta receptor. Alpha you have alpha 1 and alpha 2, and beta you have beta 1 and beta 2 and beta 3. Now coming to the alpha receptors. So as I've told you, they are of two subtypes, alpha 1 and alpha 2, and they are usually excitatory in nature. Okay. Now alpha 1 is present not only postsynaptically, you have to understand alpha 2 is present even presynaptically. Presynaptically means here. Okay, here. So alpha receptors, alpha 1 is usually present postsynaptically. So alpha 1 receptors usually mediate the smooth muscle contraction. So as I've told you, they usually produce excitatory effects in most of the organs, except very few. We'll come to that later. So you can see the location of each receptor on the organs and the response they produce. So on the blood vessels, alpha 1 receptor is located on the vascular smooth muscles of arterioles and veins, on the eyes, and which produces vasoconstriction. So that's the main response seen on stimulation of the alpha 1 receptor, which is vasoconstriction. On the eyes, alpha 1 receptor is present on the radial muscles. So when constricted, it can lead to mydriasis. Okay, when stimulated, it can lead to mydriasis, that is dilatation of the pupil. On the GIT sphincter, especially on the lower esophageal, pyloric, ileocecal and alien sphincters, the responses upon stimulation, there is contraction of the sphincters, and the GI smooth muscle and the alpha receptors are located throughout the GI tract, which can reduce the motility. So everywhere there is stimulation, but except in the GI tract where there is inhibition of motility. That is mainly by indirect release via the decrease in ACH release. So next is in the bladder. So look, receptor alpha 1 is receptor is located in the internal urethral sphincter, which on contraction can produce urinary retention. Uterus receptor is present on the smooth muscle, which can produce mild contraction, especially full term uterus. Ureter, smooth muscle of the ureter contains alpha 1 receptors, which can increase the tone. Salivary glands, so they are present in the glands. mainly in the SNR cells, which are responsible for the thick and viscous secretion of the saliva. On the skin, pilomata muscles, there is piloerection. On the liver, there is glycogenolysis. That action is very mild. So, in short, on alpha 1 receptors, mainly they produce contraction of the smooth muscle, be it the blood vessel, they are producing vasoconstriction, and the other muscles also, other smooth muscles also. Now coming to the alpha 2 receptors. So alpha 2 receptors, they are mainly presynaptic. We saw alpha 1 is postsynaptically present, whereas alpha 2 is present presynaptic also here. So this is the synapse presynaptic, okay, on the adrenergic nerve ending. And this alpha 2 is inhibitory, okay. So when noradrenaline binds to this alpha 2 receptors in the presynaptic terminal, it further inhibits the release of noradrenaline. So this, it's like a negative feedback mechanism. So when there is overstimulation, noradrenaline can go and bind to the alpha 2 receptors, which will prevent the further release of noradrenaline. So that's a negative feedback mechanism. It is also present on the cholinergic nerve terminal, which can inhibit the release of acetylcholine also. So, location of alpha 2 receptors mainly on the presynaptic membrane, which can inhibit the further noradrenaline release. It is also present on the pancreatic islets, which can reduce the insulin secretion and increase blood glucose level. And on the GI smooth muscle, and the enteric neurons, where they can reduce the acetylcholine release, which can reduce the motility and also reduce the secretions. In platelets, they have minor action. In blood vessels also. In platelets, they promote the platelet aggregation, and in blood vessels, there is a mild vasoconstriction. And in the CNS, mainly in the brain stem, the receptors are present presynaptic as well as postsynaptic, and on activation, they can reduce the sympathetic outflow, which can produce fall in BP and fall in heart rate. So alpha 2 receptor, which mainly inhibit the noradrenaline release by a negative feedback mechanism, and by acting on the brain's stem, they can reduce the or decrease the sympathetic outflow. So other minor processes, which are inhibited by stimulation of alpha 2 receptors, insulin, they can inhibit acetylcholine release in the GIT, inhibit noradrenaline release, and GI motility and secretion. So that's about the alpha receptors. Now coming to the beta receptors. So beta receptors, you have three subtypes. You have beta 1, beta 2 and beta 3, of which they are usually inhibitory. Okay. So beta 1 receptor mainly is present in the heart as well as in the kidney. So by stimulating, when beta 1 receptors are stimulated in the heart, it can reduce the heart rate, it can increase the force of contraction and conduction velocity. So there is positive chronotropic, inotropic and dromotropic activity. So overall, it can increase cardiac output. Beta 1 receptors is also present in the juxtaglomerular cells of the kidney. So when stimulated, it can stimulate the release of renin. Okay. So if you know the RAS pathway, so when renin is released, it can increase angiotensin level, aldosterone, and increase the BP. So beta 1 receptor mainly present in the heart and the kidney, which can produce stimulation of the heart and renin release. So specific location of beta 1 receptor is mainly present in the pacemaker cells, which can increase the heart rate, and it is present in the AV node in the conducting tissue and the ventricular myocardium in the contractile tissue. That is how they can increase the heart rate, conduction velocity and contractility. It is also present in the kidney on the juxtaglomerular cells of the kidney, which can increase the renin release, which can increase angiotensin II formation, and increase in BP is also seen. There is a minor role in adipose tissue on the fat cells where there is mild increase in lipolysis. Coming to the beta 2 receptors, uh, they are also present postsynaptically as well as presynaptically. Presynaptically, they are usually facilitatory. So, postsynaptically, the general functions, beta 2 receptor mainly cause smooth muscle relaxation, which is opposite to that of alpha 1 receptors. So, it is mainly present in the bronchial smooth muscle of the lungs, which can produce bronchodilation. It is present in the blood vessels of the skeletal muscle. Location is mainly the vascular smooth muscle, which produces vasodilatation. And in uterus, and usually pregnant full-term uterus, in the uterine smooth muscle, which can also produce relaxation. In the GI tract, throughout the tract, they can produce relaxation and decrease in motility. Urinary bladder, dextrosum muscle in the urinary bladder, which produces relaxation. Hepatocytes in the liver, glycogenolysis and gluconeogenesis. Skeletal muscles, mainly on the muscle fibers, which can increase the potassium uptake. So as I've told you, beta receptors also seen presynaptically. So this is the beta receptor, which can facilitate the neurotransmitter release at the adrenergic nerve ending. So you have the adrenaline here, noradrenaline, which is present in the synapse. Once it comes and fuses, there is a release of noradrenaline. This is a synapse. Okay. So it mainly beta 2 mainly produces relaxation of the smooth muscle. Now coming to the beta 3 receptors, which is very minor, it is usually related with lipolysis and thermogenesis. So they are found predominantly in the adipocytes, brown adipocytes as well as white adipocytes. So there is lipolysis, increase in lipolysis, which can produce increase in free fatty acids. There is thermogenesis and heat production. So thereby they cause mobilization of the energy stores during stress, and it's important for body temperature regulation, especially in neonates. So beta 3 receptors are associated with fat breakdown and heat generation. So receptor regulation, it may not remain the same throughout. So the effect can wax and wane. So these are the processes under which it is regulated. Now coming to the summary. So you have alpha receptors and beta receptors. Alpha 1 is mainly seen in the smooth muscle, salivary glands and liver cells, which can produce contraction of the smooth muscle, especially vasoconstriction. Alpha 2 is seen presynaptically on the nerve ending, as also on postsynaptic in the brain, beta pancreatic cells, vascular smooth muscle, which can decrease or produce inhibition of noradrenaline release. Beta 1 is mainly present, predominantly seen in the heart and the juxtaglomerular apparatus of the kidney, where it can produce stimulation of the heart and renin release. Beta 2 receptors mainly present in the bronchial smooth muscles, blood vessels of the skeletal muscle, uterus, GIT, urinary tract, eye and liver, which can produce relaxation, dilatation and also the release. Beta 3 mainly in the adipocytes, which can produce fat breakdown. That is a summary. Thank you for listening. Have a nice day.